Prathima, how are you today?
I'm very well, thank you.
Good. What questions do you have to throw at me today?
Yeah, so just general questions about Pap smear that so many patients ask us on a daily basis. So about the Pap smears, which is so common that we see every day.
Yeah.
So what is a Pap smear?
So basically, a Pap smear is a test of the mouth of the uterus, which is called the cervix. And this is done particularly to prevent cervical cancer. So what is important to understand is it's not a test to detect cancer. This is a test to prevent cancer. And this is done in all women between the ages of 25 and 65.
And the second question that we get is, everybody should do it, or only who have risk factors should do it?
So what we normally advise is that all women who are sexually active should have it done. And such of those who've had abnormal smears should have that done regularly. And if they've had hysterectomies, which is removal of the uterus for an abnormal smear or any other abnormality related particularly to the cervix, they should have it regularly. Yeah.
And the second most common question is about HPV vaccination. So I think most of the people want to know about it.
Yeah. So HPV vaccine is something that's been with us for a few years now. And it is a vaccine that, well, let me tell you what HPV means. It means human papillomavirus. Human papillomavirus causes cervical cancer, apart from a few other cancers, and also genital warts. So we now have a vaccine, and we've had it for some years, which, if taken appropriately, will help reduce the risk of cervical cancer. Now, remember, it does not prevent it completely. So it means despite having the HPV vaccination, you'll still have to continue with the Pap smears. Who do we advise takes these vaccinations? We advise it in all girls and boys between the ages of 12 and 14, and women up to the age of 45, it has now been found, can also take this.
Okay. Yeah. And what about the Pap smears after HPV if I have already been vaccinated?
So again, as I said, HPV vaccination doesn't mean that you will never get cervical cancer. It means that your risk is reduced. So you will continue to have your Pap smears every 3 years, or as advised by your gynecologist, up to the age of 65.
Yeah.
Okay.
Yeah.
So I think in conclusion, what is important is that all women see their gynecologists, who will then decide how appropriate it is for them to have the Pap smears and the HPV vaccination. Because what is important to remember, and that is the take-home message, is that this test prevents cancer. Yeah. And of course, in unfortunate women who've never had a Pap smear before, it can pick up early cancer, which is amenable to treatment.
Correct.
Yeah. Good.
Thank you.
Not at all.